All right, awesome. So thank you for joining us. Super lucky here to have Dr. Brennan Donahue, Dr. Tyler Bryant, and Dr. Ryan Brinker. Like I was saying just before, this is a lot of my business is about finding the right people, the right resources for my athletes to go to. Because I try to treat Spewak training as if we're a professional sports team, if we're a college team. So these guys have all done, just background for you guys, they've done amazing work for our athletes, and but also just getting to know them as people has been great, and we line up so well in terms of philosophies, but just how they treat their patients and all the the care that they're providing. So super lucky to have them. What I'm gonna have to do real fast is just we can start with Brennan here. Just give us a little more just an introduction of yourself, a little background of what you guys do at your practice, and then we'll kind of go through the line. And just to give a heads up to people that are watching in here, if you have specific questions, I have a few questions I'm going to be firing off to them. But if you have questions, just put them in the chat box there, and we'll answer it as we go. So everybody ready to do this?
Let's do it.
Awesome.
Looking at the faces, I think I know most of you. But I am Brennan. I have Donahue Chiropractic over in Shrewsbury. I've been here for about 3 years, and I have luckily been working with Mark for about 2 years, actually, as a running coach. Do a lot of soft tissue work, active release technique, and then I actually just last week finished out a little rehab space in the back of my office and put down rubber flooring to help focus on rehab side as well, to kind of complement the motion distortion that we kind of treat also. So that's about me. Mark, you're still muted.
Here we go. Tyler, you want to join in?
Sure. Hello. I know a handful of names. And so Tyler Bryant, I own Inbox Functional Rehab. It's in the U Club Tower in Brentwood. So the big black high rise right across from the Galleria. Coma Coffee's in the bottom. And I've been there at that location for 2.5 years. Wow. Prior to that, I did a little stint with CIHP in Kirkwood, Dr. Skaggs, Dr. George, and the crew there. Prior to that, I was in Texas for a few years, doing treatment-wise very similar to Brennan. It's all manual therapy, so I use my hands. Not a bunch of tool work, but a lot of manual therapy based with, and then paired with active recovery, which is a fancy way to say rehab exercises. Find your weaknesses, strengthen those weaknesses in a safe environment, so then you can then get back to the things that you're doing that you love to do without kind of some inhibitions and things.
Awesome, thank you. And Dr. Brinker? Mute, sorry. Yeah, I'm mute.
There we go. All right. Hey, I'm Dr. Ryan Brinker. I am a owner over here at Back Pain Center. We're in O'Fallon, Missouri. We are a kind of multidisciplinary practice. We have everything from chiropractic to functional rehabilitation, functional medicine doctors, radiology, and massage therapy all on site. We are kind of that new evidence-based approach, just like the two other docs that are on this call. Little bit of chiropractic and a lot of soft tissue, a lot of rehab. We have a gym and office. Don't take Back Pain Center as anything of what we do. It was bought under that name 13 years ago by our original doctor and just never rebranded. So we're very much a sports med, functional rehabilitation-based clinic. And we just opened our second office about 2 months ago, or about a month and a half ago. I know, great timing. Out in Winsville, Missouri. So we have 2 offices now and seven doctors. So for this, I had an athletic training degree from Lindenwood, worked with the St. Louis Rams for 3 years before moving on to graduate work at Logan. Thanks for having me, Mark.
Yeah, awesome. All right, well, thanks for joining us, guys. And actually, I already have a question, so we'll start off with Jill's question to start with for you guys. So how this works, I'll just ask the question, and doctors feel free to jump in and go from there. So what is the what is the one most important thing runners can do proactively to prevent injury? And make sure you unmute.
Yeah, I'll take, it's the biggest thing is something that the three of us don't do. You won't get it from us. And it's to have someone keeping you accountable, like having a coach. Because a lot of times what I see with runners is the answer is you just run more. And sometimes that's not the answer. So a coach is going to manage your volume in a way that you're going to be able to recover between runs. You're going to not just run 4 miles a day for 3 days, and then the next week you'll run 5, and the next week you'll run 6. So a lot of it is because proactive. That's the biggest thing in your question, is keeping someone on your team that's going to help manage yourself.
Anybody else want to dive into that one? That was good.
I know Ryan's answer. Ryan, are you going to pop in?
Hey, Jill. Yeah, I mean, I can pop in. I definitely want to go ahead and mirror what Tyler said. You definitely have to have someone that is not going to let you undertrain or overtrain. Both are so imperative to keeping an athlete healthy. But, you know, if you want to dive into what we do on our end, then I would say it's the strength component. If nothing else, more than manual therapies, more than anything else, teaching someone to move efficiently and move within their means, strengthen, you know, where they don't move effectively, and try to decrease their compensatory patterns. And I would say that is one of the biggest things we do on our end, secondarily to quality coaching.
Yeah, I'm going to follow that up and just add probably exactly what the other two were also hinting at, is that I think doing some type of movement assessment on a regular basis is extremely important to know what you're strengthening, where your weaknesses are, and how to address them. And so most people on this call probably have the coaching part, which is great. So outside of that, it's rare that you hear about a reoccurring movement assessment on a yearly basis even. We go for yearly physicals to our MD. If we're running for 5 or 10 years plus, we need to get a baseline somewhere in there to know which direction we're going to move forward. Especially if an injury pops up, we know where your baseline was, where we should be able to get you back to. So I'll just add that in there.
Awesome. Yeah. Thanks, guys. You know, so we were talking about this before we started recording, but, you know, a lot of people, you know, I don't want to generalize, but there is always kind of that hesitation to go to a chiropractor, you know, in terms of with sports related injuries. You know, we've all had that situation where we've gone to our MD and you get a script and you might go to PT, you might not go to PT, and the issue doesn't get resolved. I'm someone who has really benefited from care. I worked with Dr. Bryant several times, and I've seen the benefit. I know why it works. Could you guys share, you know, kind of your experience and maybe like your elevator pitch to a runner that might be hesitant to use your services, and how you might want to sway them to using, you know, obviously your care?
Sure, I'll start. Since you mentioned me. Yeah, and I appreciate the trust, Mark. That means more than you know, but you also do know that the best thing is friend or family referral, in the sense that you're in the service one-on-one business. So my elevator pitch doesn't have the word chiropractor in it, because you're going to get a lot of connotations, maybe positive, maybe negative, with that. So if I say chiro, someone's going to say they had a great experience or a bad one, and I believe in it. And the answer I give is maybe a little cocky, but it's like, I didn't realize it was a religion. So you can believe in whatever you want. The fact of the matter is we're practitioners that are going to help you learn more about your body, because you only get the one. You don't get to replace belts and things like it's a vehicle and rotate tires and things. And so what I do is a full body assessment in terms of your physical attributes and what's going on. Tell me what your pain is. And then we look at it from a global perspective, but also getting into a little bit more of the mental space. Like, what is it that this pain or this dysfunction is not allowing you to do? Because that's the driver. So finding some drivers that are going to help propel you to make some change, but then also finding the triggers that are irritating it. Because then if you can find the light switch, you know how to turn the lights on and off. And then with that, it's going to be, my treatment manually is going to be a lot of hands-on physical therapy in the sense of technique-wise, but then also corrective exercises. I'll write it down, we'll rehab it, but we're going to look for the lowest hanging fruit. You're not getting photocopies of 16 different exercises, because let's get real, you're not going to do them. No one's going to do them. I won't do them. And so let's find maybe 2 or 3 things that you can manage that's going to move the needle, right? The 80-20 principle. So that's where we start. And the other thing is people like to ask visits, like how long is it going to take? Sometimes it's the first initial visit is basically the metaphor I use is you just bang the lid on the pickle jar, right? You may not get it open, but we got to find something that's going to move the needle just a little bit. And then once we get some traction, then things start to roll in the right direction.
Awesome.
I can follow up if you want, Mark.
Perfect.
All right. So, great metaphor there, Tyler, by the way. Really enjoyed that. He said everything. I mean, I feel like all 3 of us are going to come up with a lot of the same answers through this whole process here and talk. But another piece that I'd like to add to that is we're great gatekeepers. We are the type of guys that aren't going to keep you in our office if you don't need to be here. It's our job to find out, is this something that we can assist you with in getting better and getting more functional, or, do you need some manual therapies, or is this something that needs to be kicked out to an ortho? Is this something that we need, some radiology, some imaging done, or is this a neuro that needs to work at this? We aren't going to hold on to you and just rack up a bunch of visits when it's not our cup of tea, right? So we just want people to trust us that we're not going to, scam them. We're not going to run up a bunch of visits on them. We are a treat and release type group. I can probably speak that for all 3 of us. And we don't want to just hang on to you for a lifetime and say, like, every little bit of maintenance we do is necessity for you to stay a strong runner, because that may not be true. That's what you're there for. You can assist them and tell them, hey, you know what, something doesn't look right, go get checked out, and we will be able to tell them, is this something that I want to work on, or do we want to go ahead and start kicking you over to someone else? Oh, I just went black screen here.
Awesome.
All right.
Yeah, that's perfect. Yeah, great. Just kind of following up on this, because you guys bring up so many so much great information that I feel like there's several points to all this. And I guess a question for you guys would be, is there a specific, because you guys, a lot of, obviously Brennan, we talked about ART or, specific things, like, are there specific things that you guys are doing regularly with runners that you're not doing with other athletes, and give a little more perspective of like what that visit might look for somebody, like for myself. Like, I don't always go to see Dr. Bryant when I'm injured. It might be kind of going for a session before I have a big race, or I'm coming off a race. If you guys give a little more clarification there, that'd be great. Thank you.
I think it's sport specific, right? And so knowing what a runner does for this point of conversation is being able to digest a pace and a cadence and things that like you will be pointing out, but then just working through those things on injury prevention, right? They can come in with pain, but it might not be because black and white, as an example, X, Y, Z. But diving deeper into those questions that I wouldn't ask a layperson who's not I wouldn't ask a CrossFitter what their cadence is. It doesn't apply. So answering those questions is important, but then making sure that they're in peak performance, right? I mean, everybody at the end of a treatment plan, most people right before the race think they're hurt, when really it's just the programming is set up that way, right? You're supposed to feel crummy 2 weeks out before a race. And helping guide those people through that mental capacity that they're going to be okay, take a day or 2 rest, and they're going to get to the other side for the most part. Most runners know when something's wrong, and if you haven't experienced that, you're going to know. And that's kind of what I say to people.
There is something, one of the areas in which
Yeah, that's sports specificity is huge. That's a big point that Brennan makes, because CrossFitters won't know what a cadence is at all. Go hard. That's their cadence. But in terms of like personally, Mark, we can kind of use you as an example. If you're going to come to me preemptively before a race because you know you're going to open up the throttle and you're going to try to go ham on this thing, then we're going to do a little bit of basically just a full body workup of where are the biggest things we can make the difference with the least amount of time, right? Again, the lowest hanging fruit principle. And most of the time that's going to be lower extremity, but also hips, and not just the hip, but the lateral aspect or the outside of your hips. And that goes for every runner, because you run in a straight line. Running is forward, right? If you go to the side, that's going to be called a shuffle, we'll say for semantics. So you basically run forward and backward. You don't go laterally. So then if you can strengthen and address some of the capacities of those hip structures, that's going to make the forward and backward a whole lot more efficient. And if you're efficient, you're going to be able to get from A to B very quickly, which is the whole goal of running a race. And so that's basically, and that's just with you, because we've discussed that, but that's with a lot of runners, which kind of circles back to Jill's kind of question. Get out of the phone booth, right? Go side to side if you're going to do some strength training, rather than let's do more squats and let's do more sagittal plane motion, which is up and down. We need to go side to side.
Yeah, I love that. And I think I always kind of feel like, you know, when you're not doing your exercises, it's kind of like going to the dentist's office and not flossing. You know, I'm guilty of that. Caitlin, I know, can attest to that. She's a hygienist. She sees it every day. But, you know, you're not flossing, and then all of a sudden you have these same issues that reoccur. Oh, your gums are in this type of health, and it's because you're not flossing. And so every time it's the same process. And I think that's so similar for distance runners, especially and myself included. Like, we can be very arrogant in the sense that, oh, we go out there, we run every day, we work our legs. Why would we need to take the extra time to strength train or do these exercises? Everything's fine. And then that rubber band breaks, and it's, you know, you're wondering, how did it ever get to this point? I'd never seen, you know, an injury in my entire life. And it's like, well, you know, if you would have done X, Y, Z, be more consistent about those things, you know, you wouldn't be in that same hole. And so what I love, you know, about being able to also see, you know, just it's, you know, in terms of just getting this kind of care, it's also accountability in a lot of ways too. So not only are you helping yourself in regard to getting the care itself, but then you have somebody that's giving you exercises, or somebody that's working with you and knows specifically you, and knows exactly what you want. And what these guys are saying is that they're not going to bring somebody into their office and then try to sell them 30 visits and try to keep them there. They're going to bring them in their office and assess things, and make sure that we're doing right by you guys, making sure that, you know, you're carrying your best plan. So much of what I'm doing is communicating with these guys. So when they've worked with my clients, you know, I'm shooting an email over and saying, you know, if I get the go ahead from the patient themselves, and they give me the ability to speak with their physician, I'm able to jump in and say, hey, okay, what do we need to work on? You know, what is it that this person's benefit from? Can we run? That's usually a lot of the questions for running. So I see the chat before I ask my next question. Just make sure that, let's see, Katie, my chiropractor has me do functional strength exercises to keep my weak areas strong for an injury. That's great. And so I guess, like, kind of playing off of that, you know, when I think about all these things, I think about foam rolling. I think about, because we've talked about specific exercises, we've talked about strength training. Could you guys maybe categorize a few things that, you know, a runner could put into their daily routine every single day that you think would benefit from, in terms of maybe prehab or rehab work?
I'll jump in. If you can't tell, we all kind of hesitated, right? I mean, and because I think it's hard, and guidance is sometimes necessary, because I've met those people that have their foam roll and they say they foam roll. They beat the hell out of themselves. They foam roll on this thing for 10 minutes a day, and they wonder why they're sore. course you're sore, you know? And so what I mean by that is like, all things can be good in moderation, right? Foam rolling should be part of it. I like some yoga. I like the handheld things. I can't even think of the name of it right now. But all in moderation. And those all have a specific purpose where it should be loosening up a tissue. And if you get off a foam roller, or if you're rolling on a lacrosse ball, or if you're stretching and doing yoga, and yet you're walking away from that exercise and you're not feeling any different, I'd be curious to know if that's truly, if you're feeling true tightness, or if it's perceived tightness from an area above or below. And so having a true tool bag is tough, but I do like foam rollers. I do think that some type of yoga or stretching routine should be utilized. I'm guilty of not doing some of those things as well, but we all know that when we start to feel it, jump back in sooner rather than later, right? So that's kind of, I'm sure these other guys will have some other pointers as well.
I'll jump in on it. You know, one of the biggest things I'd say that we can get out of, you know, prehab, rehab, these type of things, is just moving in different planes, as Tyler talked about before. If you are continually moving in one direction using the same group of muscles, the best thing we can do in our off time off of running is move in other planes. You know, do side-to-side movements, do rotational movements, do just move. The biggest thing is just move. In your time down, don't be a couch potato. You know, go out, diversify your workouts, and just keep yourself mobile. You know, keep the joints moving through a full range of motion, because when we're running, they don't make it through that full range that a hip, a knee, an ankle can go through. So go through, do some yoga. That's going to take you through that full range of motion. You know, break down the muscle tissues a little bit, as we heard from Tyler before, and just make sure that you're, you know, doing anything to kind of just get your mental capacity up, get your physical capacity up, and take care of yourself on the nutritional realm as well. Because if we are, you know, not doing these things correctly, then everything we do in our runs is going to be an uphill battle. So it's a whole kind of universe you have to immerse yourself in whenever you want to compete at your highest level. And all three of those things, mentally, physically, and nutritionally, all have to be met. So I don't think there's one linear answer here as far as, hey, everybody should be doing this one thing before and after their races. It's more of a, you know, what your doctor, what your physician's telling you to do, maybe specifically, but outside of that, just move and take care of yourself. It's just general.
Yeah, that's so much coexists in the running world in terms of how you get better. You know, it's a lot of people want to know the specific. I mean, I'm asking you guys these questions, and I realize for running perspective, it's the same way. It's like, well, how do I get better? Do I specifically need this speed workout that's 8 times 800 meters at 10K pace? Is that going to make me the best runner? And it's, you know, like you said, it's a collective effort. Sorry, Tyler, I think I cut you out. Did you want to respond to that?
No, you're, excuse me, you're fine. Ryan makes a good point. It's not linear for everybody, but this is a pet peeve of mine, just because when I ask a question and we get kind of the full circle answer, which is the right answer, right? The classic, the boys will, the guys will understand, but the Stu McGill, it depends answer with everything. Like, what if I do this? And what if I do that? And what about this exercise? It all depends. And because N equals 1, which means every individual is just that, they're an individual. But if we're going to if there's something that hits the most people in terms of the running population, we need to work on the bottom of your foot, because that's what hits the ground every step. Especially with ankle dorsiflexion, meaning, can you bring your foot towards your face? Can you flex your ankle? Working that range of motion, as well as just your Achilles and the posterior aspects or the back aspect of your calf. Those are the big things that are going to make the most, they're going to get you the most bang for your buck. If you're going to foam roll it, if you're going to Theragun it, if you're going to stretch it, because you got to think of the ones that are taking the brunt of the load, right? It's not your wrists, it's your feet. And then the other thing is, get out of your shoes when you don't have to be in your shoes, because your feet fall asleep if they're not touching the ground. And utilizing the neurological components that the bottom of the foot has. So if you're sticking them in beautiful stiletto pointed heels, shame on you. I don't think Katie made a wonderful face. But there's a lot more drive to open-toed shoes and openness of that foot, because if you try to do a push-up in mittens, it's not going to go well. If you try to run in a smaller compressed shoe like this super awesome Nike Free that you don't have support in your intrinsic foot, then it's just going to flop, flop, flop. And then guess what? Your feet are going to hurt. And whose fault is it? Well, it's not Nike. It's the person that bought the Nikes. Not to bash on Nike, but everybody knows what a Nike Free is. So yeah, to sum up, strengthen the intrinsic foot, so toe curls and individual piano key type motions, toe yoga, and just get out of your shoes, and as well as take care of your calves and your Achilles.
Awesome. Thanks, guys. Yeah, so Katie Manga actually just put something in the chat. She has a really good question, and I'll kind of dive into it first, but just read it to you guys. So to state the obvious, high volume training makes prehab and strength work challenging to find time to do. Just so what are your thoughts in terms of the trade-offs here as it relates to the build up to the race? So for example, if needed, should we forego running miles to do the strength work? And could we do it without sacrificing performance? And this is an awesome question. This is what I love about being a coach, because there's not one specific way to a finish line. And I'll use an athlete as an example. There's a guy that I work with, worked several years with him, and every single year, his number one goal is to kick ass at Boston. That's the number one goal. And for me as a runner, and being able to build his miles has been really important. So over the years, we've built him up. When he first started with me, we might have run 25 miles a week. Now he's closer to 60 miles a week. But what we've seen as the mileage has gone up, as we've increased the volume, he tends to have some overuse injuries that pop up. Specifically, a hamstring has been in the way for him a few times. And so we're in that last build up for Boston. You think of the last 8-10 weeks. Those are the weeks where we need that bread and butter long run over the weekend. We need that speed workout on Wednesday. And we sure as hell cannot miss out on for those other days during the week. If we're trying to get to where he wants to get to, we need the mileage. But then we're also saying, well, he doesn't have time to do the other things to help him keep healthy. And so this became kind of a dilemma for us, the first time we got through, and realizing, okay, it was more important for him for staying healthy that we took away one of his running days, knowing that was gonna not sacrifice his performance, but to get to that next step in distance running, you need more volume, realizing that the strength part is actually more important so he can be healthy to be able to do what he wanted to do. And we saw tremendous results, and we've seen less injury. He's more consistent on the strength work. Do I believe that he needs more mileage for the goals that he has? Yes, absolutely. But what I do think is you have to take, instead of this long approach of this is our way, this is the highway, you have to look at it more, A, individually as the person, and B, on that specific level they're at right now. Because that's the most important thing. If you're coming to me and you are already having some trouble, and we know we need to address these issues, but I'm going to ignore that and we're going to say sacrifice, and we're going to have an issue with it. So just for you guys, if you want to dive into that, would love to hear your guys' thoughts and perspective there.
Yeah, I want to jump in really quick. Just by a show of hands, how many people have heard, running's bad for your knees, right? We hear that all the time, right? And let's debunk that a little bit. And I'm sure these guys are going to jump in a little bit. Dr. Mashard, he a human locomotion guy. Injury-Free Running is his book. And in there, he talks about how if we strength train just 3 months, if we can do some type of regimen for 2 to 3 times a week for 3 months out of the entire year, you'll stay injury-free. You should stay injury-free. And so that means for 9 months, you don't have to do any strength training. And that's when you can ramp up the mileage a little bit. So winter, great time to do strength training. And the reasoning behind that is it actually builds up the muscle fibers enough to where it keeps the ligament and the tendons healthy and enough fluid going to there. So the other thing is that we have bad knees as we run longer. If we're running with, pardon my French, but shitty form, because we don't have the muscle strength to maintain form at mile 20, 22, 24, then yes, we are going to have knee pain. We're going to have ankle pain. We're going to have hip pain. But if you're able to build up your quads and your hamstrings to be your elastic bands as we go through knee flexion and extension, you're not wearing down your meniscus inside your knee. So you're going to cut down the chances of arthritis and meniscal injuries. So knowing that it's not always a long-term, hour-long fitness workout that we talk about when we mean strength training. Sometimes it can be 10 minutes a day of stand on one leg and bend down and touch the ground and come back up. So it's a matter of finding what strength you need and then building a plan off that. But I think it should complement miles greatly. There's a little girl over there, Morgan. Hey, girl. So when people hear strength, they think that, oh man, I got to do a 1 hour strength workout 4 or 5 times a week. And that's just not the case. If you were trying to become bigger and stronger in the gym, then yes, you would have to cut down mileage. It's a matter of that balance between the two.
I'll piggyback that. I'm glad you brought up Tom Michaud because anybody who's listening today should definitely pick up his book. The Injury-Free Running is a great book for everybody to read. And then if you want something that's going to be hard to digest, you can also jump into Human Locomotion, which the majority of people in here would probably have to dissect pretty hard because I've had to read that book about 4 times just to understand it. But it's a phenomenal read. Kind of off of Tyler's last point when he was talking about the bottom of the foot, I just want to hit that really quick as well. Tom Michaud on there talks about how the importance of toe flexor strength, so the ability to grip with your toes being so important. And in some of his newer research, post books here, he's found that by every 1 pound of force we can create in our toe strength, we can decrease fall risk in elderly and injury risk in those that are active by 7% by every 1 pound of force we can create. So the bottom of the foot is just incredibly important. But also to talk about the current topic, I believe that, you know, some type of strength training year-round is important in the way that it's going to, again, take us through ranges of motion and activate muscles that we do not use while we are running. Do I think that we need to be in the gym doing a, you know, deadlift squat routine every other day of the week? Absolutely not. But if in your off season you can go build some strength, like Brennan talked about over there, sure, absolutely. Get in there, do some stuff in the off season, get nice and strong, get those tendons, full of fluid, and get those muscle bellies nice and short and strong. That's going to make your tendons more elastic, and it's going to give you more resiliency to injury. But through the season, if you can just go in, do some range of motion, take your joints through a full range, and work a little bit of a muscle group once, maybe twice a week on a very short workout, it can just be body weight work, you're really going to decrease your chances of overuse injuries on repetitive muscle work.
Yeah, couldn't have said it better, Ryan. I have made some notes, and then you just kind of ticked off my notes. So are you watching in my office, or? Yeah, because so to hit on tendons respond to stress. So you need to put stress on them to fix your tendinitis. Everybody's had that. Names are just names of things so that insurance companies can quibble and quabble about how much they're going to reimburse, but that's another song and dance. But you got to put stress on them. Running puts stress on them, which is wonderful. So when you're in season, which is why it comes back to having a coach so that you're not trying to PR every race every weekend, because then you're always in season. If you're in season, you have a plan. That plan is to run to build yourself up. That's going to help build resiliency through those tissues. Then when you go into off season, that's when you lower your mileage and volume and you raise the time at which you're doing some prehab work. Now, that's in a perfect world. If you are in season and something happens, that's not the time to throw the plan into the trash. You don't want to throw the baby out with the bathwater. What you want to do is you take it day by day and assess what is very specifically going on and strengthen that finite piece. maybe lowering your training volume slightly, like Mark said in his example, and then focusing on that limited capacity that runner has, knowing that by focusing there, the long game is going to allow you to eventually increase mileage in a pain-free zone, in a high performance zone. Because if you're aiming at high performance, you're going to sacrifice overall health, which is why NFL players, have small length of playing careers. But if you're trying to continue to have some good overall health, you're going to sacrifice performance. You can't have both, right? Can't have your cake and eat it too. However, you can do high performance in season and then overall health off season, if that makes sense.
Yeah, awesome. Yeah, those are all great. And I think Katie, that's such a great question that you guys bring up, because that's where, and selfishly, that's where having a running coach really comes in handy, especially one that's going to be working with your strength trainer and one that's going to be able to obviously communicate with your doctor as well to put you on the best plan possible for you to be successful. So in this kind of last portion of time, we've stuck a lot of questions about, the specifics of, exercises and, what your philosophy is when you come into the room and help you. But I want to hear a little bit more of, the light side of things. So I'm going to ask a question for you guys. And my first question is going to be, what's your favorite thing about working with runners? And then it's a two-parter, what's the one thing that drives you freaking nuts about working with runners? I want to hear it, because I know that I know you guys have some perspective.
I'll jump on it. Yeah, this is fun. Favorite thing about working with a runner is not one to the next is the same. It's always like putting a puzzle together. Anytime a runner comes in, you have your corner pieces there, but now you got to fill in the rest, because everybody has their own gait patterns. They all have their own muscle patterns, their own day-to-day life that kind of challenges what they're trying to achieve. So favorite thing about working with a runner is constantly getting to use my brain and not being monotonous like you do with, the standard, low back patients and all this type of thing. But probably my least favorite is the fact that runners don't want to cross train. That's the hardest thing to get. Nobody wants to do the homework. No one wants to do strength work. So it's really hard to get a runner to kind of listen and comply to the homework.
Yeah, I'll follow that up. Favorite part is they're determined, and so they want to do the work. Least favorite part is they don't do the work, and so they're coming looking for answers, and which is fun. You can help them get those answers and understanding. You put a plan of action in course, and they don't always follow it. And I think Tyler and Ryan probably agree with this, that so many people, they think that chiropractic has to be, even sports realm has to be hands-on, meaning you have to be in the office to get a result, which I think is so not true. To be able to give someone the homework and say, now I need you to do it, this is going to prevent you from having to come in 3 times a week, can be the cream of the crop, right? If they end up doing it, they get the results and they don't have to come into the office 3 times a week. So favorite part is definitely that how determined they are because they want to work hard. Least favorite is that they don't follow through.
I'll go in. I think the best part about being a coach is being able to help someone achieve a goal they thought was never possible. So I'm working with 2 people now from the 5K that I coached last summer, and was coaching now for the half marathon, and getting them both to do their first half marathon, and neither one of them thought they could even do 3 miles, let alone a half marathon. And it's just getting involved with them, and that kind of makes me forget my aches and pains, and it helps me to stay motivated to make sure that I'm following the plan so that I can be a good role model. So I think, but like everybody's saying, it's hard to keep people on the plan, but these 2 in particular, we're going to run again this evening. So, and I know some people say, oh, we shouldn't be doing it together, but we've been running the last 3 weeks, 3 times a week, and we're all quarantined at home. And so we all feel like we're all pretty safe with each other, but we do try to stay apart. But That's the two things. I think, just helping people achieve a goal that they never thought possible. So I just ran a half marathon, virtual marathon for the Go with Xylena in my group, who's only 18. She's a senior in high school, and she, everything is being canceled for her as a senior in high school, her prom, the play she was working on, graduation, whatever. And she had emailed me and said, hey, would I do the half marathon virtually with her for the Go? And my first impulse was to say, oh, I don't know if I want to do that. But I said yes. And I was so glad I did, because she'd had so many other guys and male role models in her life. She doesn't have very many positive ones, and they'd all let her down. And so her uncle, who I also was in the group, was just so happy that I did that for her. So it's amazing what you can do for people that you don't even realize that you're doing. So I just thank you guys for keeping us safe and healthy as we're doing all this, all you guys.
Yeah, the big thing that runners have goals. That's one of my favorite things. So living vicariously through some of the crazy human feats that some runners want to do. The greatest example, well, I have two. I'll never be as fast as Mark, so when he tells me times that he's running, it just blows my mind. And I'm like, man, that's moving for long periods of time. Like, I might be able to do it for 10 steps, but not for 10,000. And I had a patient once, he ran the Tahoe 200, took him 96 hours. Like, the fact that he wanted to do that is unbelievable and craziness. And the negative thing is the toenails. They're pretty gross.
I couldn't agree more. You guys do not want to see my toenails right now. I always say that you have to go in the summertime, if you go to the pool, you got to wear socks. And you're telling everybody it's a statement that you're trying to make. It's a cool way to go, because you do not want to uncover what's under there. Another question I guess I have for you guys is, and I know that if you can't answer this, I completely understand because of HIPAA, but do you have any, patient stories, like testimonials or anything that you'd want to share in terms of really successful chiropractic care with running, or anything that, you want to share just even in the running realm?
Yep. Anybody? We're all kind of hesitating here. Trying to find the one we can probably talk about without giving too much up. It's kind of cool. You have all the good ones, and then I can also throw probably some bad ones in there. I'm not gonna, toot my own horn and say I've cured every person that's walked through my doors, but there's been some really, really great turnarounds. One would be 2 years ago. I had a first-time runner come into my office, had just ran the Go marathon, did really well, missed her goal time by just, it was less than a minute, I believe. And it was a very big number for this person to hit, and came to my office that week and said, my calves were just giving out on me at the end. They were cramping up so bad. I don't feel like I can run again, but I'm in the best shape of my life. I have another race I want to run in 2 weeks. Both were marathons. And all we did was some soft tissue work. We did some dry needling and just some basic tendon loading. And she went back 2 weeks later, hit that goal race, another marathon 2 weeks later. I know, it's crazy. Hit her goal and hit a big qualifying time, and was probably my greatest success story right there on the turnaround at that, and especially at such a high level athlete.
Yeah, I've got, I mentioned the guy that ran the Tahoe 200. He kept talking about it. He's like, when are my Achilles going to stop hurting? And I said, when you stop running 100 miles a week. So for weeks and weeks and weeks. And he said, well, I got to train. So I said, well, we'll get you there, but it's not going to feel awesome, which everybody knows when you're in the thick of it, it's not going to be great. The most recent one, I guess, would be, I actually utilized one of Ryan's colleagues. He does diagnostic ultrasound, Dr. Welk. And he came in as a good friend of mine, and he was training for Big Sur. And this was going to be the biggest run he had in a while. A runner previously, and then kids and new business and life and all of that, all of those variables got into play. So he was coming back, and he would get into 15, 16, 17 miles and have these kind of knee pains. And long story short, he came in after I worked on him a couple times, got good results pretty quickly. And then he went out for a big long run and came in, and his lower leg was so swollen, pitting it was like playing with Play-Doh on his ankle, pitting edema. You could stick your thumb into it and it would conform. And I said, listen, man, he didn't even know, couldn't even see it. And which is really rewarding in our end, because we're trying to, I'm trying to make you healthy, right? And make you the best human being you can physically be. So we utilized, I sent him to Ryan's office, and just to make sure everything was good. Everything came back fine. And I told him, I said, make sure you drink a ton of water. Now, retrospectively, he was very dehydrated, and it was the first hot day that it had been a couple years ago. So all those compounding factors made it manageable, but ends up being fine, because I said, I'm not letting you go to California to run this race if you're going to have a DVT and you're going to throw a clot. So we got to clear our bases. And he ended up running, and he PR'd for his distance out in California. And if anybody's ever been out to Big Sur, I've not run it. I drove it, and that was exhausting driving the thing, let alone running those hills. But it's beautiful out there. But that's my big success story. And it was really fun, especially utilizing the multidisciplinary approach. Like, I might not be the guy to help fix you, but I'm going to get you to a person that can be that guy.
Mine doesn't directly relate to a finish line, but I actually had a few patients that saw each other in passing. I don't know, how long's Big River training team been around? I don't know the answer to that question. Mark, you might know.
Yeah, I believe they had some form of it since their beginning, their inception. You know, Ben Rosario used to run training groups. So I would assume that I could be wrong on this, but I assume probably 2008, 2009, where they really formed the big group.
Which makes more sense. I had a group of gals who ended up seeing each other in passing in the office. They hadn't seen each other in a long time, and come to find out they ran together with Big River running 10 years ago, and they all had stopped running, and they have since reconnected because they ran at the same pace, and they are now working towards 5K and then hopefully further. So that was kind of a fun situation where it's like, I have an open kind of setting here in my office, and so they saw each other, they reconnected, and now they're back running and chasing their goals together. So that was kind of my fun one.
Yeah, that's awesome. And it's I've not been around running that long. I've been around running for 15 years, but just even in the St. Louis community, I've been 14 of the 15 years here in St. Louis running. And it's you see in phases, and I'm sure like somebody like Jill, who's run with several groups, over the years, and you see phases of people, and they're in and they're out, but it's almost like the running bond is always what connects you. And, even if you miss out on 5-6 years of running, just having that, I'm trying to find the right word for it, just the tool of being able to run and then come back to it. We're very grateful, very lucky to be able to have that as terms of our choice of exercise. So for any of you guys, if you know somebody in your life who was running a ton and then they're, not running at all for whatever circumstances that is, I always just say encourage them to, do something, or encourage them to know that when they want to come back, they're always welcome. And I think that's what's so amazing about the running community. We have such great people that are there. So my last thing, just kind of before we finish this up, is just give you guys the opportunity, Coach or Dr. Bryant, Dr. Donahue, and Dr. Brinker, any closing words that you might have for everybody in this chat, or just anybody at home that are listening, anything that you guys kind of want to, pass on before we finish up.
Excuse me, I'll grab it since you said me first. The big thing is, I guess the biggest take home I would say is trust your gut. You know more about your body than anybody else does. It doesn't matter how many letters someone has after their name or what alphabet soup they have on their wall. They're not you. So you know if something is, that's uncomfortable, but I can push through that. Or if it's like, yeah, I don't like that feeling. Trust it, and then speak to the people that you then trust their opinion of, because they will help direct you to other people that maybe you don't have the understanding of where to go. Like if I don't know where to go, so talk to Mark, because Mark will help direct you into the right kind of avenue. Another thing is just get out of your shoes. Walk around barefoot, especially right now because we can't really go anywhere. So walk around your yard and your grass and wake your feet up. You'll see benefit from that.
My closing remark is quit hammering every single run you go out and do. I say that to myself almost every day, but it's okay to run slow. There's a method to the madness, and I got to remind myself of that every time I go out and run. That slow days should be slow, fast days, get after it. That's all I have. Mark, thanks for having us. Guys, thanks for asking questions, and reach out in the Facebook group, the Spewak group, if you have anything else you need answered.
Yeah, you Dr. Donahue just pretty much stole that out of my mouth right there. Yeah, just, take some easy runs, listen to your body. You know yourself the best. I mean, these two guys summed it up perfectly. And stay mentally sound. If you go out there one day and your heart's not in it, that's obviously a day where you're not going to have a good run. Listen not only to your body, but listen to your brain. If it's saying, hey, I just don't feel like doing this today, take it easy. Use that as a good recovery day. Take it nice and easy, because if your brain's not in it, your body's not going to be in it. And you guys really need to take care of yourselves mentally as well as physically. So again, I'll mirror Dr. Donahue and Dr. Bryant. I appreciate all you guys logging on, and Mark for having us. So thanks, and hope your guys' training seasons are going well and you actually get to race one of these days.
Yeah, thank you so much, guys. Really appreciate you guys being here. One of the big things for me during this time is just to make sure that not just for our team, but for just the general public, that we can provide as much content and knowledge to everybody as possible, because everybody needs help. And my hope is that for you guys that are watching this, or watching this at home that weren't participating on our Zoom call, you can share this with somebody in your network to give them some help during these tough times. So thank you very much, and I'll make sure that all three of you guys' information in terms of your social media platforms and contact info is sent out, and hopefully you guys found a benefit in tuning in. So thanks for spending an hour with us this afternoon, and we'll try to do more of these kind of things coming up. So please take a look at your emails and your Facebook group. So take care, guys. Thank you very much, and stay safe, stay healthy. All right.